Good afternoon, everyone. Dr. James Lyons-Weiler coming to you live from the WWDNYK studios in Pittsburgh, Pennsylvania. Today, we're going to be getting into, guess what? Coronavirus. You cannot look anywhere on the planet without seeing something about coronavirus. I saw someone had ordered some coffee from somewhere, and on the carafe of the coffee, it said caffeine until vaccine. It seems like everyone is willfully joining in the propaganda machine to make sure everybody knows something about coronavirus, as if nobody knows anything about coronavirus. And I'm so glad today to share with you my guest, who is Theron Hutton. And Dr. Theron Hutton is a fantastic physician. I'm going to embarrass him by bringing him on and uh, reading his reading his bio while he's here. So welcome, Theron. Thanks for being
Thank
here.
you. Thanks, Jack. Great to be here. Appreciate you having me.
Right on. So I want my people to know that Dr. Theron Hutton graduated with a bachelor's in biology. Go bio nerds. Right
All
on.
right.
And got his medical degree from University of Arkansas in 2003. He completed a general surgery internship and family medicine residency in 2007. He then moved to Uganda, where he met his family and lived for 5 years. There, his practice included hospital medicine, community medicine, and in Africa, he completed intensive coursework, went in-field training in Lesotho, and became a sustainable agricultural trainer and organizer. Man after my own heart. I've just taken up back to
I
Eden
saw
Gardening.
that. Nice.
Yeah, we're going to talk some about that. That's turning into a real riot. He has also completed many hours of emergency medicine and critical care training. He was board certified in family medicine in 2008. He is now certified in functional medicine through the Institute of Functional Medicine. That's awesome. Have to understand, Tony Bark was huge on functional medicine. He
Yep.
has held academic positions at Washington University School of Medicine, Harding University, and let's see if I can pronounce
Right
this,
on.
Mbarara University of
Yeah.
Science and Technology. Very cool. He is the medical director of Mulberry Clinics, a private direct primary care clinic in Spring Hill, Tennessee, that within 4 years has grown from himself to one nurse and two doctors, two mid-level clinicians, and seven support staff. He is a sought-after speaker because of his unique experience and perspectives on health. He is a father of eight, and he internet stalks Joel Salatin with his free time and has had supper with him recently. He loves to read Wendell Berry by the fire in his 64-acre farm. Now, is that your farm or Wendell Berry's farm?
No, that's mine. I wish
That's
it was mine.
cool. So his website is dochuttonmd.com, and he can be found on Facebook and Twitter. And we met because I put out this early article saying we're going to need to talk about therapeutics here. This is not going to be, a slam dunk. We've got a virus. We're going to get a vaccine. Everybody go home. And I had done modeling, and the modeling showed that if we did a strict lockdown for just a couple of weeks, maybe 60% is pretty strict in the United States, and then added effective therapeutics that were maybe only effective 60% of the time. And you answered the call. You saw it and you said, hey, Jack, listen, you need to understand there's some other kind of therapies out there. And so I added those, and I wanted to thank you for reaching out and pushing those, pushing knowledge at me on that. I'm really grateful for that. So, what's it like in a small clinic in Tennessee with coronavirus? What's the size of the town you're in, and how many patients do you see?
So the town itself's like 35, 40,000 and growing. It's like one of the fastest growing counties in the nation south of Nashville right now. A lot of folks moving in from outside, and look, it's kind of a nice place to be right now. A lot of folks are looking for a good doctor, and a lot of part of the country, especially where folks are moving from California, the upper Midwest, they know about functional integrative medicine, and it's a part of their life already. So they kind of move here looking for it, and we're here. And so, like you said in the intro, we've had to really expand our staff and capacity to accommodate folks. But it's been interesting because we've I have very specific questions to my patients and to our area And of course, in this age of internet, social media, and access to information, we hear about New York City, and we hear about Chicago, and we hear about New Jersey, and we hear about places in California, and so my patients want to know: are we like them? Are we next? How are we different? How are we the same? And so it's been interesting and fun in a nerdy kind of way, to try to gather all that information and make sense of it for folks, and specifically customize and tailor it for our unique community here.
Yeah, absolutely. So, with that size of the community, then, people get respiratory viruses, they get flu every year, they get some kind of coronavirus, and so on. Do you see a large number of patients that are at risk, a special risk, like the diabetics and the elderly?
Yeah, we do. We have I mean, it's interesting. Folks come here to retire. We've got favorable tax policies. It's a nice climate. It's we usually get how we expanded is we had patients come for jobs. Music industry's big, automotive industry's real big, and then like what happened with our family, the parents come to visit the grandkids and end up staying. So my kids, both of their sets of grandparents live within a mile or so of them, and so that's a very common demographic here. So we have a lot of retired folks, and unfortunately, that 45% of Americans that are in that metabolic syndrome range, we're not exempt from that by any stretch. So we have an elderly population, and we have a population who's otherwise at risk for comorbidities, things like that. So we've got them all for sure.
Okay, so I've spoken with a lot of physicians in small clinics. They seem to have very little serious illness, in spite of the fact that they're looking at these demographics, and they look very low mortality. The small clinics appear to take a holistic or functional medicine approach, and so I'm going to ask you. You don't have to report it, but have you had mortalities in your clinic from coronavirus?
Zero. Had no mortalities. I had one patient who we had to send to the hospital. I strongly suspect he had it, even though he had two negative tests. I'd still bet. I don't know if I'd bet my farm. My wife might not like that, but I'd bet something on it. And yeah, I would agree with that. And that's what I'm hearing from my colleagues around the country. And it'd be interesting to look at this in detail. But, right from the beginning, even before the beginning, and as soon as you and I started collaborating on what this was, what we might be dealing with, and treatments, I mean, I got the word out, super fast. We have a private members only Facebook page. We do live updates with them just about every day. I get my nurse practitioner, myself on there. And I'm like, hey, here's what we learned today. Here's what we learned today. Here's what we learned today. And I make sure I'm like, get outside, get your vitamin D. Here are the recommendations. Here's the supplements. They're in stock. Let's get them. And people responded very quickly to that. And I credit them for, I credit our relationship, I think, for their willingness and ability to react quickly to our recommendations.
Sounds like you've built a community of people that trust you, and I can see why. You're a genuine enthusiast for reality. Right?
Yeah, yeah,
That's what we have in common. A genuine enthusiast for
yeah,
reality. And
yeah.
go ahead.
Yeah, I like how you put that. I would. That's for sure. I would agree with that, and I do. It's taken me 4 or 5 years, I think, to build trust. But that's probably the single most important thing that we offer our patients.
That's absolutely beautiful. So in your small clinic, I'm a 52-year-old guy. I'm reasonably healthy. I get outside. I'm active. Um, I show up and I've got symptoms of coronavirus at the beginning of the outbreak, before you had access to testing, right? But what would
Yeah.
you do for me?
Well, and we did. It's funny because we did that. So we know I know my patients well enough now, and I even have a little flag on their chart. Like I have some patients who are, we joke about it, they're pathologically averse to prescription medications. I mean, for whatever reason. So if I even start to talk about a prescription, they're just they sheet white. Nope, nope, can't do it. But they would take supplements and herbs and other remedies all day long. And then I have other ones that are the exact opposite. So I pride our clinic and myself and my staff in again having that kind of relationship with our patients and knowing them, knowing that about them. And like I tell them, I was like, when I first got out of training, my tool bag was small, and one of the things I've tried to do over time is expand my tool bag. So, okay, you don't want to use the prescription. Well, I've got an option for you that you can try, and it might be an herb or a nutraceutical or a supplement or something else.
Sure.
And that's so. First thing would be I'd probably know what you were inclined to want to do, but we'd certainly have the discussion. And to me, and it's gaining some traction now, but I'm pretty certain that the COVID-19's been around longer than March. We're pretty sure
Yeah,
even
yeah.
some of our staff may have had it, you know, earlier this year, late December, early January, and I've got some stories to probably back that up. But I mean, so interesting story about this guy. But anyways, the diagnosis is made clinically always, and I think we got off the rails with this pretty early with COVID-19, and even the MDs that were telling us what to do kept talking about testing, testing, testing. And you're taught in med school day one, 70% of diagnoses are made from simply talking to your patient.
Yeah.
And then another 20% after that, once you do your physical exam on them. And the laboratory test is there just to confirm your suspicion. So so if I talk to you and I'm like, man, this looks and sounds like the flu, we'd probably do a flu test, although I don't always. And then it's negative, and that happened a bunch of times this winter, by the way. This looks like the
So
flu to
much
me.
so that you noticed it, right?
Yeah,
So
yeah. Like, good
okay.
grief, this flu test should be positive, and it's not. And we'd bring him back again 3 days later and do it again, just because we were like so confused by it.
Hmm.
Um, And then I honestly, probably before I even looked it up, I started saying, well, maybe an antibiotic will help. Maybe azithromycin, and it's not the rare person that I actually give zinc to anyway, to see if we can't give their immune system a little support.
It's the first thing I
Uh,
do when I get a cold is I take some zinc and vitamin A and
oh
D.
yeah,
Yeah.
yeah, yeah. Yeah, so we actually had a patient very much like that this year, and not surprisingly, but when I look at some of the literature, there's some good theory out now about the androgenic theory of this disease, where folks that have high androgen levels, obviously men, and then men of a certain race and age, and then women who also fit a certain category, maybe PCOS or something, that the androgen pathway has a lot to do with priming the spike protein and allowing entry into cells. So that's super interesting to me too. Um, anyway, this patient that we were worried about, turns out he was on testosterone, which was interesting, but now not super surprising. So.
Yeah. Yeah. Very, very cool. So he got better, I take it, after
He did. Yep.
his, mild interventions, nothing serious.
Yeah.
Yeah.
Yeah. Yeah. Yeah. We gave him some antibiotics, and he spent a few hours in the ER just to get checked out, and then was sent home. I just checked on him a couple days ago, and he's recovering nicely. So
Yeah.
yeah.
Very cool. So let's talk a little bit about your ideas on why, or what you know about why hydroxychloroquine um, should be effective, might be effective here. Let's explain what you mean by a zinc ionophore.
Well, an interesting story about that as I was unpacking this and looking into it is that I have a good friend who was living overseas in Uganda, and they actually moved back in January. He and his family. They flew into Washington State and went through the same airport, like a couple days behind where apparently the patient number one in Washington State also went through that airport. And he said he and his family just got this flu-like illness, heavy respiratory symptoms for several days, and they just couldn't knock it. All but his wife, who interestingly has RA and was on
Mhm.
Plaquenil. So it's just super interesting that hydroxychloroquine, which is Plaquenil, seemed to protect this woman from symptoms, anyways. So when he told me that, I was like, man, that just fits perfectly into what we've been thinking. So if if you look at the way, and actually, I'll plug my friend Jill Carnahan. She did a beautiful summary of emerging theories on COVID-19, and she talks a little bit about zinc ionophore in her blog. It's super good. I wish I could write as well as she did, but she's got some really cool information in there about all of the treatments and why they work and how they work. So
Okay.
it's good stuff. So if you you probably know, your audience is smart. So, it's hydroxychloroquine's, relationship to zinc. So that's one of the things. Another thing is there's a really elegant study done out of China where they took the binding protein site for the heme binding protein, and they figured out through molecular modeling where that bound to hemoglobin. And then they looked at the structure of this was just chloroquine. They looked at the structure of chloroquine and did all kind of, molecular docking models and all of this amazing stuff. And they figured out, based on the protein sequence and structure of this 3D computer modeling they did, where the chloroquine would bind the subunit of the hemoglobin and how it knocks the iron out of the porphyrin ring and leaves just free porphyrin. It's just amazing to see that as a possible second alternative to how chloroquine or hydroxychloroquine chloroquine works. But yeah, so what happens with hydroxychloroquine and zinc is the zinc it enhances. The hydroxychloroquine enhances your body's ability to push zinc into the cells. And then when intracellular concentrations of zinc are increased, then viral activity, the ability of the virus to replicate, is decreased. So that's kind of the simple explanation of that. But then you get these toxic overload of zinc inside the cell, essentially, which inhibits the viral replication of that. So
you kind of stuck with your lung tissue not really replicating that well for a while, but that's not as nearly as bad as the cells dying. So yeah.
Right. Yeah. And interestingly, probably seeing that some of the symptoms that people have experienced initially is lost some altered sense of taste and smell, which is associated also with zinc deficiency too. So there might be an interesting correlation there as well.
Fascinating. So on the grand rounds here, have you seen any cases? I've seen them of people that were on immunomodulatory drugs for like some blood cancers, and because they were on the immunomodulatory drugs, they were sick with COVID-19, and then it was time for their dose. They took their dose, and then it just dissipated, just clearly went away.
Yeah. Yep.
And that fits my COVID-19 multi-system organ attack, immune response. This virus has a very long time in the human body compared to other viruses. And that's
Yeah.
that's a deep concern for autoimmunity against the proteins that match human proteins.
Yeah.
You get immunity against the viral proteins, and then so I published, as people might know, I published in the Journal of Translational Research this month a list of peptides that are likely to be problematic in any vaccine. That if they make a vaccine, they're going to end up with what they call disease enhancement, what we're recasting as pathogenic priming.
Yeah.
Um, so that makes sense. The immunomodulation for late, stage. The people have you had any patients that seem to be getting better but then got worse? That seems to be reported quite often.
Uh, yes. Yeah. I mean, I had some this winter again before I would say COVID-19 was on our radar. It does seem like there is sort of this up and down recovery that does occur, and I haven't really found a good explanation for that.
Yeah,
So
that
so
fits the hypothesis that it might be around long enough to induce autoimmunity. Usually, you need a second
mhm.
exposure, you get
Yeah.
primed by the first infection by a virus, and then on second infection, then you get the autoimmunity, or on injection against the same
Yeah.
virus if you've had an
Yeah.
infection. So
Yeah.
this is around long enough, I think, that it might be a very effective, pathogen at making people sick, but it's not a very good
Yeah.
pathogen from its own perspectives. What other
Yeah.
observations have you had?
Well, you mentioned the vaccine, and unfortunately, our governor, Governor Lee, he has strongly encouraged us to self quarantine, but he has said that it might be 18 months before life returns to normal because that's how long it's going to take to develop a vaccine, and it's I think it's unfortunate and probably misplaced in order for so many people to be hanging their hats on this hope. I mean, when Paul Offit is concerned about the development of this vaccine, I mean, I think we've got to pay attention. Uh,
I think that's the opening of the seventh seal. Actually, that was the sign of the end times for me. And when Del Bigtree and Paul Offit or Peter Hotez came to an agreement on, that a vaccine here might be problematic. That was it.
yeah,
I'm packing my
yeah.
bags.
I had to like clean out my ears for a second. I think even Dell was like, I know, everybody. I'm agreeing with Dr. Offit on this one." So,
Yeah,
uh, yeah, I
yeah.
mean, if you read his interview that he had on the Center for Inquiry, Paul Offit's interview, and he just, halfway down they start asking about the vaccine, and he responds like, "We've never been successful at developing a good coronavirus vaccine. Is it going to be an mRNA vaccine? Is it going to be a DNA vaccine? Is it going to be a purified protein vaccine? And
Right.
of course, then he says, and certainly the FDA has to be well involved with this. And he draws sort of a faulty conclusion because he says, uh, you know, FDA needs to regulate this product because everybody in the United States would take this vaccine even if it wasn't tested. Now, I can tell you right now that's not true. Um, but I mean, it is alarming that he has concerns. He says, either we're going to take 2 years to develop this thing and it's going to be too late, or we're going to rush it and do it poorly. So,
Yeah, absolutely. So one of the action items I just put out today actually was everyone needs to contact their congressmen and their senators at the federal level and say, if they don't do animal testing for pathogenic priming and send them our study, the IPAC study, if they don't do that and show that there's no pathogenic priming or a disease enhancement caused by their vaccine, once the animals are injected, they're then exposed to the wild virus. And then if they have increased mortality relative to those who are not vaccinated, um, then they don't get to proceed to phase two. This is a
yeah,
reasonable stopgap for a reasonable approach to translational science here, as opposed to let's just run for as sprint 18 months as fast as we can, make all the mistakes that we can, no checks on the process, and
yeah,
then you prime the entire population. So today, Paul Offit apparently or recently, he's been resharpening his horns and fluffing up his tail because he's all set now on CNN calling out the public for wanting to have the right to choose. On a CNN story, he asked the question, "Do you have?" I want to get it right exactly how he said it because I gave a retort to it. But "Do you have an inalienable right?" He said, um, as I'm bringing it up right now, and let's see, coming up.
Well, that's one of the things I have affirmed my patients over and over is, that's a hill I'll die I'll die on that one for them. They
Well, I won't die on the hill of pathogenic priming. That's the whole point.
yeah,
So they
true.
talk about needing herd immunity, but they want to lock everybody down, which you can't get herd immunity if you're locking them down. So Dell's point is well taken,
Right.
but
Yep.
still, I'm not convinced that you're not going to get pathogenic priming if you're infected. There are many, many viruses that cause autoimmunity, and the onset of immunity, autoimmunity happens with the second infection. And so, if there's another,
Yep.
through all the mechanisms we know about, the original antigenic sin, it doesn't have to be a vaccine that primes you. It could be this.
Right.
So here it is on CNN Health. The exact quote at the end, of course, they give the Pope, Paul, the anti-Pope, Paul Offit, the last word here. Um, he says, let's see, a lot of really interesting people here. Sorry about this, folks. He says, it's a long article. It's about anti vaxxers changing their mind and changing their tune because of coronavirus. And I don't think that that's exactly what's going on. I think, it hasn't, I've not met anyone who's changed their vaccine risk awareness on the basis of the fact. So here it is. I'm sorry. Paul Offit asks, is it your inalienable right as a U.S. citizen or as a citizen of any country to either allow yourself or your child to be infected with a disease that's potentially fatal and it's transmissive? And he says, I think the answer to that question is no. And so I asked, um, is it pharma's or allopathic medicine's inalienable right to expose 100% of the population to deadly pathogenic priming risk from the untested COVID-19 vaccine? I think the answer to that is no. So, it's not as though there's not arguments on both sides. If they can come up with a safe vaccine, remove the absolutely remove the epitopes that are going to cause pathogenic priming, make sure they screen them, don't have aluminum adjuvant, which we know causes autoimmunity. Maybe do microneedle and then respect choice. If they, do, this is very simple. There's a very simple algorithm here. Have all the
Yep.
vaccines you want, but respect our choice. Not if we tend not to tolerate vaccination, or if we just don't think that that should happen to us. It is our
Yep.
right to determine what goes into our body. It is our choice.
Yep.
Sometimes, this is the nanny state. Sometimes we need
Yep.
to be able to take control of our own destiny and live by our own decisions, live and die by our own decisions. And the
Sure.
nanny state wants to come in and say, you don't have an immune system unless pharma gave it to you. You were
Right.
not born with an immune system. You have to have
Yep.
this artificial immunity. That's the only choice that you can opt for. And I can object on so many grounds, such as, that's forced consumerism.
Yep.
There's no way that a government should force you to consume any commercial product. You just get runaway unethical capitalism that way. What do you
Yep.
think?
Well, we went to a freedom rally yesterday in Nashville, and it was great. Like I hadn't actually done much of that before, and we didn't love. We weren't really, protest was a strong word for me, but I I have partly built my practice on trust and parental choice and patient choice, and I have patients that are all over the spectrum in terms of vaccination and not vaccination. And I have said, look, I will close my practice down before I force you to do anything that is against your preference, against your will, against your beliefs. I'll go and grow vegetables or something if they let me do that. And anyway, so we went to a rally on the Capitol yesterday, and it was great people, peaceful. We were outside in the sunshine,
Mhm.
and I appreciated it on so many levels because, even as a physician, I have to place medical or health concerns as a high priority in my profession. But I think it's surprising to some people that I also feel like individual liberty and freedom and economic, removing as much economic consequence from this as we possibly can. And I think
Yeah.
being able to hold all of those three things in some tension is important and takes wisdom and takes a certain type of character, which people see in you. But yeah, that troubles me. And I have patients. I talked to one this morning that is just beside herself, feeling like her rights are going to be taken away from her in terms of the decision whether or not to be vaccinated. And I think that leads into the testing conversation as well. And we can talk about how we did this, but following your cue, I really honed my testing protocol and offered them. And I said, look, we don't really want to know your results. I don't. I mean, I want to know your results very anonymously, just for our research, because I'd like to know.
It's
But
a
I don't
clue.
want to know.
Yeah, it's a
I don't
clue.
want to know your name and what your antibody status is. And as same thing for vaccines. It just shouldn't happen.
Yeah, absolutely. So you've tried a couple of different tests in your clinic, I understand.
Yep.
Before we talked about doing diagnosis before there was a test, and the RT-PCR test. If people don't, if you're under a rock somewhere, welcome back to the planet Earth, because CDC messed up their testing bad. They sent out a flawed test. The story line, the party line, is that they actually had a contamination event in the lab, and that led to a problem. I think that is actually driving people to think, oh, that means that all the problems with the test are actually false positives. That's not
Yep.
what happened. What happened is that they had a problem with primers. And if the primers aren't working, that can also lead to false negatives, which means they let people walk. And those people are,
Yep.
and I'm not talking about freedom. I'm talking about, wait a minute, here's your test
Right.
result. You're negative. You're good to go, as opposed to, here's your test result. You're positive. You might want to self quarantine and watch for certain symptoms because you might need early medical care. It might help you. Instead, they're going to drop these patients after testing the patients on the Princess cruise ship at a mall. If they tested
Yeah.
negative, knowing that they hadn't tested their own test. The
Yeah.
Germans had a test that was, already validated as well as the Germans could. It was readily available.
Yep.
I've still seen to this day zero science, zero estimates of the accuracy of sensitivity, specificity, pathogenic specificity of the CDC's tests. And if I keep asking every time I go on the air, if somebody has those data, please send them to me so I can stop asking for them. CDC doesn't write
Yep.
back to me anymore. FDA stopped writing back to me. They were thankful that I was pointing out problems in the primer sets initially. They're like, "Oh, well, thank you.
Yep.
We'll take this up with the group." But the testing that you brought on, there was a rapid test from South Korea. It was biomedomics, and you've
Yep.
subsequently moved on to a different one. So, what was your experience with biomedomics?
Well, I liked biogenomics, and honestly, we ended up not getting any of those. The
Okay.
quantity, I mean, that's the downside. The volume that we needed to order in order to. So it was just, we kind of looked at them, and then we looked at Ray Biotech, and they look like very equivalent tests. So Ray is manufactured in Georgia with some Asian components, they said. And ended up being a really good option for us in terms of price point. It looked like they had good data behind it, and they could get it to us pretty fast in boxes of 20. And our staff did a miraculous job at rolling that test out. I was so proud of them. Because two of them said, "No, what's the big deal?" Because you're used to going to your doctor's office, getting a test done. They record it in the medical chart, and you just move on with life. And I said, "Hang on, pause. Here's how we want to do that." And a couple of them, they gave pause and thought about that, and like, "Man, you know what? You're right." Yeah, yeah. And I was
It's
like,
right.
"Yes."
For the patient to know their status is valuable to the patient, and
Yeah.
sometimes not so valuable to the medical practitioner. And that
Yeah.
brings up the topic of private testing. And I am literally pulling what hair I have left on the top of my head out, because every time I engage in social media or on conference calls, we need private testing. Everyone says, why are you proposing what Bill Gates proposing? We don't want testing. I mean, there
Yeah.
seems to be a knee-jerk, deeply conditioned response that if it's
Yeah.
a test, it has to be reported. And
Right.
I've made it really clear that private testing means private. There's a hashtag private
Yeah.
means private. But
Yeah.
the second, I think the fight. I called it yesterday, last night. I was writing a blog. 12/26. I published a blog article. I said this is the week that we're going to have a fight over private versus public testing, reported
Yeah.
testing. And what did I wake up to this morning on CNN? But or ABC News on YouTube, a doctor that works for, I forget his name, saying some pretty good things about testing, like, hey, it would be useful for people to know their status because then they might be able to get back to work tomorrow. So they're
Yeah.
getting the
Yeah.
clue, but
Yeah.
he's insisting on clinical testing only. And clinical testing only mucks everything up. It just ties everything up into knots because doctors don't want to shut down their clinics. Doctors don't want
Right.
to have to decontaminate everything and everybody. The reporting to the state is actually not necessary if it's a private test. And I know people are probably sick of hearing me say this, but you could get an HIV test at the local drugstore. You can get a paternity
Yeah.
test. You could get a drug test for your kids. You can get STD test. And of course, you can get a pregnancy test. And so
Yeah.
now I'm at the point there and where I'm saying, okay, people are saying, well, I don't want to have that test because they're going to demand the results. I said, when's the last time you took a temperature with a thermometer?
Yeah.
Right. Well, I don't
Right.
want to do it
And they made a
voluntarily.
decision based on that. Yeah.
I don't want to do it voluntarily. Well, that even it means that you're practicing in some program. I mean, you're participating in some program. It's not
Right.
voluntary. It's non-compulsory.
Right.
Non-compulsory means I just want the damn test so I know my result. I still don't know my
Right.
result. I don't know
Yeah.
my result, and I was sick as a dog in January, February, and I'm scared of infecting my fiance who has diabetes. So I would really like to know that she and I have already had it and we're in the clear, and then we can let her
Yeah.
hair down a little bit. Other people, I work from home. I do all my research and scientific publications and design studies and things like that from home. And so technically, I'm like, this is no change for me, except for I
Yeah.
don't go out as much. But for some
Yeah.
people, this is like they're going to lose everything. They're going to lose their
Yeah.
businesses. They're going
Yeah.
to lose their shop. They're going to lose their income. They lose their job. So
Yeah.
those people should be able to test every day or never. If they don't want to test, they
Right.
shouldn't have to test. But having the test gives you a peace of mind to know what your options are. And it's
Yeah.
so difficult, Theron. Why is it so difficult? What am I missing? What am I saying wrong? What am I not explaining right? I'm frustrated.
Well, you're right. I mean, it's a brand. Well, there's a bunch of issues. I think that the tiny issue I've had is, like, let's say my patients test one way or another. Let's say they test positive and they know that result. Now they want to go and open their business back up. Then the health department is going to say, okay, fine, we relent to, you have antibodies, you say, now give us some proof. And I think the part of the problem is going to be that the citizen's word is not going to hold up when the authorities want proof. That's one of their concerns.
Okay, so let's do this
That,
one at a time. And when people say that to me, I say that's why you should stop telling me what a problem it is and pick
yeah,
up the phone, call your legislator, and say we want to make that illegal. We want
yeah,
mandatory reporting of my status. You can't
yeah,
know somebody's HIV status. Your employee
right, yeah,
cannot know your status. They might be
yeah,
concerned that if they share a toilet with you or whatever concoction they
yeah,
have in their head, okay, the laws are already on the books to protect your medical privacy. So the
yeah,
person that says we need that status that you have, that
yeah,
you took, they're violating your rights. So you need
yeah,
to call your legislators and you need to say we want affirmation of our rights to know our status without the government knowing, without our employees knowing. And so the answer to the response, I'm afraid that they're going to want my results anyway, is to codify it with new legislation that says, or a memorandum from the House or whatever that
yeah.
says we are not going to violate privacy.
I
And,
mean,
and
it feels
people,
like a HIPAA violation already. The law's there. I mean, I guess we probably need to make it have more teeth, I guess.
But here's why you can't just go. I can't go to CVS right now because the FDA specifically has not approved a Biomedomics or Array
Yeah.
Biotech or Vibrant America's antibody tests for commercial use, for private consumption, for
Yeah.
public consumption, and that's what needs to change. So rather than tell
Well, I
me how
don't even
different,
like. Yeah,
yeah,
they have to come into my office. I mean, I have to order the test for them right now, and they have to come into my office and pick it up. I mean, I don't even want that to happen. I'm just
right.
like, I don't even want to know.
Right.
You know, I now I
And
know
you're a
I
saint
know
for doing it for them. You really are a saint. You're one of the best people that I know, a very ethical physician. And so what I'm saying is that when people, I've spent way too much time trying to convince people that when I say private, I mean private. When I say you need to fight for private, and some analogies have come to mind. It's like, all right, and I'm really hoping that you can help me communicate it better, Theron, because it's been frustrating. Hey, if I say to Grace, honey, the house is on fire and we're going to need the fire hose. We're going to need the hose because I'm going to try to put the fire out. And then she turns to me and she says, yeah, but you know the house is on fire? That's the
yeah,
logic, right? It's like, okay, other people say we don't want to open up the can of worms. I'm sorry, I see all over the headlines that mandatory testing is coming.
right.
Mandatory state-reported testing. You're going to have a vaccine card. The can of
Yep.
worms is spilt out all over
So
the dinner table. Okay,
yeah,
we're not going to open up a can of worms here. This is not
yeah,
a concession either. This is not a
yeah,
concession. This is a demand on our. And so people say, I don't want to give an inch. I say, me either. I want to take the whole football field.
right.
Right. So this is what I'm
Yep.
saying. It's up to us as private citizens, as individuals, as physicians and scientists to stand up and say that the American public are not babies that need to be babysat by a nanny state, that they're going to make the right decision. It turns out that their own best self-interest is if you're infected and you have an active infection with the test will tell you, contrary to what
Yeah,
was said on ABC News this morning by that
yeah,
doctor, there's two antibodies. If you're not going to go open up your work and infect all your workers,
right,
that's that. So
right.
in this, people will act selfishly in their own self-interest based on their own results by not visiting their sick aunt or their grandmother, by staying away from diabetics or whatever until they're immune. And then once they're immune, they can say, "Hey, I'm a superhero. I've got this. Like I'm great, good to go."
Yeah,
And it's really, really strange. It's like hurts my head that the vaccine risk aware community, who's been clamoring for things like titer testing, for
yeah,
herd immunity through natural infection,
yeah,
don't want to know their status. It's like
yeah,
they're giving something up to someone and just take your temperature at
yeah.
home. Have you ever reported your temperature to the CDC when you were at home?
Right.
That I don't get it. It's like I want to hire somebody to explain it because
Yeah.
I can't do it anymore. I'm
Well, I
blue in
think
the
it
face.
feels. Yeah, you're right. Yeah, and I think it's just going to take time. It feels like something that is so top down that how can this end up with me in my bathroom with me poking my finger while I'm sitting on the toilet. But you're right. I mean, and that's what I've had to like over and over with my patients. Like, we have a sheet. Check this box. You want this anonymous? Yes. Here's, go home. Do this test. We put a video on our Facebook, Mulberry Clinic's Facebook. I mean, my nurse is literally like, "Here's how you do the test. Poke your finger over here because it hurts on here, and then we show them how to do it, how to interpret it. Go on
Right.
Facebook if you need it. But so we have another rally, a statewide rally coming up next weekend, and I'm half tempted to stand up with the microphone and tell people. It hurt. I mean, my blood was boiling when I came in here and heard the clinic down the street was doing swab testing. Like, it's a walk-in clinic basically for anybody who wanted it. So it sounds so wonderful. This was like 6 weeks ago.
Yeah.
And I'm like, people, I have lived in places around the world where the prime mechanism for the spread of contagion was the healthcare clinic.
Exactly right.
Ebola and all stuff. And so you have all these people who, a couple of them are sick. They're going to contaminate the healthcare workers,
Yep.
and then they're going to contaminate every single person that comes in just so they can charge that visit and charge for that test and do nothing useful with it, because at that time they weren't even admitting they could treat it or do anything to
Yeah,
take care of it. So they just
exactly.
saw this demand for testing. They
Yeah.
saw an opportunity to do it. It wasn't private. They didn't know how to do it right. And people were clamoring. And then the reason I rolled this out so fast and really just stressed my staff out, because Tennessee started offering drive up free testing locations, almost doing the same exact thing. And I'm like, I don't want my patients, or anybody, but especially my patients, going and doing one of these where they have to register and fill out
Yep.
all this information,
Yep.
and so it
So,
ugh.
so you're a good man, and so the anonymous testing is still a billable service to recover the cost of the time
Sure.
and the expense and all that. But private testing, I've learned to be really specific about this, is you go to CVS, you bring it home, you unwrap it, it sits on the counter for a day. You might do it, you might not. You call your mom, you talk about it. Should I take the test? I don't know. Do you have to report it? No. Okay, well, why don't you
Yeah.
take the test, honey? And then you take the test, and do you have to look at the stick? No, you don't have to. You put the blood stick on it, you can put it away if you don't want to see it.
Right.
At every point in this process, you could back out, and then you go, okay, I know my status. Now what am I going to do?
Yep.
You can throw the stick away, and you not tell anybody that you ever took the test.
Yep.
And so I think
Yep.
what's missing is when people say, no, I don't want to test. They're not understanding that private means private, but that aborts the conversation about why it's so important that as many people get tested as possible, as quickly as possible. If
Yep.
90% of us are already immune, and we're all testing immune, no vaccine.
Yep.
What's the point?
We're done.
We're
Yep.
done. So everyone that's vaccine risk aware, if you love me, if you respect me, I'm not putting our relationship on the line, but I'm sorry, I'm not going to explain this anymore. I have so much more important things to do than to explain the definition of private. Please check out hashtag #IPackBackToWork. Send it to your legislators. Think about this. Literally stop and think. And there's a blog article I wrote last night that says, read this sentence, and in the sentence it says something about independent immunity through natural exposure and versus mandatory vaccination, and then read it again, and then the third sentence I say, okay, close your eyes and think about those sentences, and then I say, read this one, and it says private testing versus reported testing. It's incredible how ingrained it is. I think it's the fear factor. I think it's too good to be true that we could actually have that right. But you do have the right to that. You got to stand up for the right. We have to change. The FDA's regulation has to change so that all antibody tests can be bought by private citizens and used. And when we do that, mass consumption will drive production, and then it'll come
Yep.
down to $10 a test, and
Yep.
there's no price gouging there. So
Oh, I've had labs calling my clinic already. Just, I mean, a small clinic as we are, just saying, "Oh, we hear you're doing testing. Would you use ours?" They're clamoring to get this out. We just have to make it available.
yeah, fantastic. Yeah, they're ready to go. And because for them, they're just reprogramming existing technology on testing, right? They're
Yeah.
using the same, they can produce these antibodies pretty quickly. So please, 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 please do that. All right. So what's your next move in this? You're going to rallies, you're getting sunshine, you're out farming. Tell me
Yep.
about your farming. Uh, your, your,
Well, so like you mentioned in the introduction, I ended up going to Africa to be a physician and treat medical needs. But it turns out people actually need to eat good food in order to be healthy. So I quickly figured out how to adapt my urban neighborhood grown up history of not knowing where food came from, and quickly figured out how to not only learn it for myself, but I mean, teach probably is even a strong word. Just kind of get people to start talking to each other and figuring out how to do it for themselves in the best way that they could do it, and ended up probably doing way more good as a physician healer with agriculture than I did with any medical knowledge that I had. So then, brought that. Really, I developed a passion for good food and the effect that being outside in nature and in the sun had on our health. and brought that back here, and it's funny because I kind of got fired from my first physician job for talking too much about nutrition. I was flabbergasted when I had an appointment with the HR, head of HR, who, she said she'd been getting complaints from patients about me, talking too much about nutrition, which I could understand patients complaining about it, but it shocked me that HR would complain about it. So I said, well, it's obvious that I'm not here for the right reason. Apparently, you got the wrong guy. So I think my patients are probably close to getting sick of hearing about nutrition from me. I hope so. But then, I think it's important to, as best you can, live what you're teaching people. And I'm all for local, sustainable, healthy, earth regenerative farming. And, it's good for everybody. It's good for your neighbor. It's good for you. It's good for the planet. I tell people if everybody farmed like, Joel Salatin, Wendell Berry, and I think it's Paul something, that guy that farmed, Back to Eden guy, I'd be out of a job. And that'd be okay with me. I'd just join them.
Well, what you're doing is you're actually reducing the chronic exposure to toxins,
Yeah.
and that is probably the most powerful thing a physician can do over the course of a person's life. One of the most powerful, if not everything,
Sure.
because it's the chronic exposures that lead to synergistic toxicities. It's the chronic exposures, like, 20 years ago, 30 years ago, fluoride might not have been as a big problem. There might have been a signal of increased risk of cancer. But now we've got so many other, hundreds of thousands of chemicals and everything. You got to look at the label to see if there's any corn syrup in everything. I mean, why would they put corn syrup in coffee creamer? It doesn't, why would they put corn syrup in these foods that are labeled healthy for you? And it's a cost savings. And so, I'm getting into Back to Eden as well, trying to get a lot of sunshine, a lot more activity. I'm pretty sedentary in my work, and if people want to know about it, it's layering, right? So you put down some kind of a paper to weed block. It's and then you put compost. We did a mix of 50-50 compost and soil because I didn't want to rob the plants of minerals, and then wood chips. And the wood chips keep the moisture, the humidity stable, and then apparently you get a lot more yield that way without as much weeding and all the rest. So
you're doing it now, that I saw.
Yeah, we've got a bed we're putting in. I'm going to do a video on it and share it because I think it's important that we become able to feed ourselves. I mean, the minute, they said in Pittsburgh, in Pennsylvania, sorry, that the small farmers, the small independent farmers are non-essential. And I'm like, okay, that's a corporation that has political influence that's shutting down local food production so that their stores don't go to waste. That's an economic move. That's a sin. These people, this is their livelihood, for crying out loud. So, I hope that gets reversed. I know in Pennsylvania, there's a lot of companies that are just ignoring the order not to work. They're just continuing to do business, and it's a gamish. What I'd like to see is a rational return to normalcy with people testing themselves and going, okay, where do I stand? And then making their own decision. So, alrighty. Right. Well, this has been fantastic, and I'm going to pull up your website here. The URL, I put it in here so people can see. And you also have some videos on how to self-test on Facebook, you said?
So, I'll make those public. They're on our members, but I'll make those public.
Yeah, cool. Yeah, so there's the IPAC COVID-19 Get Back to Work plan. I remember you wrote that up. That's cool. And amplifying that. So you're like one of my brothers from another mother, man. I mean, it's That's really a pleasure to.
I told my staff, the day we were kind of emailing back and forth with the therapies and nutraceuticals, I was like, man, this is one of the funnest days I've had in a long time, because while it is awesome to be in a small clinic and somewhat independent, that collaboration, is missing sometimes. So it's nice to have it. And, of course, in this age of internet and social media, it's a little bit easier to have on some level. But
Well, if
so
any
that
of our
was cool.
listeners have specific questions for you, where can they email you?
You can just Hutton MD at Mulberry Clinics with an S at the end.com.
And you're
Mulberry
on
Clinics.
Facebook as well, huh? Well, maybe we'll
Yeah, I'm
do
on
like a
Facebook. Yeah.
maybe we'll do a Ask the Doctor Facebook live together or something. We'll set that up, and I'll moderate the questions for you sometime.
Yeah, that'd be super fun. I'd love that.
Yeah, absolutely. You're an important guy in
Well,
this. So
Jack, I appreciate you, man. I know you didn't get on here to hear me give you accolades, but I love your books and the work you do, and you're an independent scientist too, and that's hard to do now, and it's super valuable and needed. I mean, so many of my patients, they have the information. It's not, we don't live in a paucity of information. We have all the information we could ever want. It's just figuring out who to trust and who's trying to sell me something and who has an agenda. What's the agenda? Who's biased and what is their bias? I mean, we're all biased, but what is our bias and how do we best mitigate ourselves against it affecting our decisions so profoundly and things. So I appreciate what you do, and I hope you keep it up. And anything I can do to help you, just holler. We're here.
awesome, man. Thank you. Yeah, I have no financial interest in any particular company. People say, "What's your favorite?" I'm like, "Oh, whichever. The last one I looked at looks better than the next." So, you know,
That's right.
I like because it's improving over time. What I want are
Yeah.
people to be able to be free to make their choice.
Yeah.
I want people to be healthy. I want people to have good, healthy minds. And this is
Yeah.
terror. This is terrorism. The way that our government handles this is terrorism.
Yeah.
It's so infuriating to see people do the bidding of their oppressors by saying, "Oh, it's not going to work anyway because they got all the cards."
Yeah.
That's like a woman who's been abused by her husband so long that you get her to the side and you say, she's talking to her sister. Well, why don't you try this? Oh, because he'll just do that.
Yeah.
It's not healthy. It's very
Yeah.
dysfunctional to look at this problem. You have the control over your body, and it's your job to make sure the government doesn't take control of it. They're
Yeah.
using drones. I just heard they're using. I saw a story. They're using drones in New Jersey to see if you're
Yeah.
staying far enough away from people. And I said to
Yeah.
Grace, that infuriated me so much. I said, any drone that's going to be anywhere near me is coming down. I'm taking that sucker down. I don't care what they do to me. I'm making a statement.
Yeah.
That's the kind of thing.
In Tennessee, where I live, there's no way.
Exactly. I mean, I don't want to say anything violent against public property or anything like that, but come on, guys, wake up. This is the United States of America. They're. I don't want to go on this rant about, they're destroying public property in California. They're putting sand over the public areas, the nice natural areas. They're
Oh
setting
yeah.
They're setting,
Yeah.
there's apparently, allegedly, I should say, they're setting playgrounds on fire that are made of plastic so the kids can't play on them. I don't know if that's true or not. Maybe some kids set one on fire, whatever. But,
Well, I know they're shut down here. All the playgrounds. I mean, I thought it was a joke when I heard the playgrounds were shut down. I was like, come on, like really? Like, I mean, show me a shred of evidence that shows kids outside playing in the sun in the 80-degree spring Tennessee weather are going to get sick. Just
that's right. So back to the drones. If I launched an initiative that you should contact your legislators to say that you don't want a drone monitoring that who you are, who you're associated with, and how close you are to them. And I got the same pushback from people who are scared. I guess it's because they're scared to say, "Oh, I don't want any drones whatsoever." Fine, but then if your kid goes missing and you ban drones, they can't use a
right.
drone to search quickly in the field.
Yeah.
If there's a real bad guy who's being chased and there's a foot chase, they can't use drones, right? But just to
Right.
monitor the public, like no. And in Italy, they're apparently taking temperatures.
Yeah.
No, these drones are coming down. I'm sorry. This is the rise of the machines, man. I'm not putting up with it. No way. So,
Nope. Yeah.
all right. Well, listen, thank you so much for being on Unbreaking Science. I'm going to make sure that this gets shared widely. Please, if you enjoyed Unbreaking Science with Dr. Theron Hutton, make sure that you like and subscribe and share and do everything everybody always tells you to do. We'll put a link to his website and so on in comments. Do you have any last words for hope?
Well, I mean, I tell my patients this all the time. I mean, there use wisdom. There are true things out there. There's a lot of not true things out there. There are true things out there. Find people who aren't trying to sell you something and listen to them. Dr. Jack's one of them, one of a few. Lots of different sources, and on, yeah, that, there is, hope. And you know what, take a break from all this sometimes. Get outside, enjoy the sunshine, go for a walk with your kids. It's still okay to be outside. Encourage your church or wherever you go to worship to start figuring out ways to get back together. And things always, and you can look through history, they turn out okay, and they will. So.
Well, thank you for that. We all definitely need that. I'm going to go haul some topsoil and compost onto my garden
All
bed
right.
now and get that sunshine that's beckoning me. Thank you so much, sir. Dr.
Yes, sir.
Jack has your back. Come back to Unbreaking Science. We broadcast irregularly, but it's really important to get the message out that Dr. Theron has. Take a rational approach to this. Don't be irrational and be excellent to each other. We're signing out.